From a human rights perspective, we always are asking the question, who's excluded? They tend to be the poorest and the most disenfranchised. My own work primarily has been in the area of HIV/AIDS. And as a practicing infectious disease epidemiologist and somebody working in a lot of environments, not thinking and not paying attention to the human rights contexts, to the social justice issues, is not good science. With the center, what we've tried to do is take the tools of modern population-based science, like sampling, accrual, biological measures, and really aim those at places in multiple countries where there are health and human rights interactions. To, for example, deal with the HIV epidemic in Thailand, we realized that one very large population of very underserved people is young gay men who are sex workers, who are selling sex. That's a discrimination issue. It's a policy issue, and it is a human rights issue. So we approached the Sex Workers in Network group. It is the union of sex workers, and we are offering a comprehensive HIV prevention program, including a new biomedical tool called PrEP, pre-exposure prophylaxis. We also have street outreach, where we encourage the folks to come in for free voluntary HIV testing. And then also, about 70% of people living with HIV in the US are not effectively treated. So we started a large 4-city study, basically a case management intervention to try and improve HIV outcomes for men who have sex with men. So it's realizing the right to health, it's dealing with the social determinants of health, and understanding these forms of stigma and discrimination are not soft issues that cause problems in health. They're fundamentally at the crux, and we need to address them.
First and foremost, of course, I need to thank the Arch.
Being the inaugural Desmond M. Tutu Professor in Public Health and Human Rights is one of the great personal honors of my life.
Well, Chris is a gifted intellectual, gifted doctor, researcher, but in addition to being tireless, he is absolutely courageous.
The Archbishop has been an icon of human rights, and Chris is a leader in the field. They do what they say they're going to do with humility.
His gift, I think, is extraordinary insight into the multiple issues, not just scientific, but political, social, and really related to human rights.
If we are going to have healthy societies, it's quite crucial that people see the provision of health as an issue. I know that struggle for human rights is in exceptional hands.